Hi, my name is Djanessa. I'm 16 years old and I was diagnosed with adolescent idiopathic scoliosis. So originally when I was diagnosed with scoliosis, I went to 4 different doctors because I needed different opinions. And I just by chance happened to find Dr. Imtiaz here at King's College London. And when I walked into his office and he explained to me my condition, I felt really safe and comforted because he explained it really well and in detail, so I knew what he was going to do. And I wasn't anxious or worried like I was at the other doctors because he really made sure to tell me everything. And even if I had any questions, he went over my questions, he showed me my x-rays, my MRIs, and everything that he was going to do. And I just felt really safe and I wasn't worried. So even leading up to the surgery, I was a lot calmer than I thought I would be. And even now, after 2 weeks after the surgery, I'm feeling really good. I'm strong, I can walk, I can stand, I can talk to my friends. And I feel really good because prior to the surgery, I was in a lot of pain in my back at school, like carrying my backpack and stuff. I was really tired all the time. So it felt really good to know that I have a doctor who knows what he's doing. And it was very comforting and safe.
My name is Dr. Imtiaz Hashmi. I am Director Spine Center of King's College Hospital, London in Dubai. They visited my clinic recently and I could see the total confusion on their mind about the pathology, the problem itself, and how to deal with this problem. She had about 4 opinions before that, and they were still not clear and all scared of this situation. So I sat with them. I spoke to the girl directly and her mother. Very pleasant girl and quite confident. And I explained everything what's wrong with her. And I made her understand the problem. So the treatment became automatically very easy for them to understand. And I could see the confidence growing between the family and the girl and myself. We decided to go for surgery, and this is about scoliosis, which is a deformity of spine, very common in this age. The surgery took about 8 hours, and it went very uneventful. We were very happy with the operation. The next day, she recovered very well, and she took few steps, which gave her more confidence in recovery with the help of physiotherapist. The following 2 days, she walked more and more, and she recovered very well.
My name is Felicia. I'm Djanessa's mom, and I'm truly so inspired by her. She was the one who found the doctor. The moment we walked into the doctor's room, he explained in detail what she had. First, we had no diagnosis. It was just called scoliosis. And then he detailed us what type of scoliosis it was. And just the comfort that I felt and the peace that I felt, it was like God led me into this room when we needed to sign the consent form. The way he went about explaining even the risks to me, it was just in another dimension. And I'm truly grateful for the work that doctor has put into helping Djanessa during this journey and this process. And the surgery itself, just to speak a little bit about the waiting time and the anxiety, he did mention that it was going to take about 8 to 10 hours, and the nurses, the hospital, it was just so calming, and I had absolutely no anxiety because I knew that the doctor was doing his work, and they kept telling me every 2 hours that, look, everything is okay. She's in the room. When it was about 6 p.m., I think 6:30 p.m., the surgery was done. They took her immediately to the surgery room. I was so pleased to see the pictures of the before and after. And honestly, it was just an amazing work that was done. And just the support and just the connection that the doctor gave to us, and support from the community, and just the love during this period, because we're obviously wondering, okay, she's going to go through a 10-hour surgery. What will happen? And the anxiety. And so it was a true experience. We stayed in the hospital for like 3 days, 4 days at tops. And the recovery process has been amazing, right, Djanessa? She's been recovering amazing. In fact, when visitors come to our home, Djanessa, they go like, oh my God, we thought we'd find you lying in a bed. It was just an experience, and I would really recommend that for quality of life and just to make things a little bit better for anybody that has to go through such a surgery.
The message is that these kind of complex surgeries become more and more easier if the patient and the attendants, they understand the problem and they know we are going to deal with this. That makes our life and their life very easy. And that makes a successful outcome of this kind of long surgeries.
So I think this has been our journey. It's a process, yeah, and we're getting there. We're definitely not where we used to be. I remember days where we had to step on her back, Mommy, I feel this, I feel that. She's truly such a hero for us, and even the pain, the way the pain management was handled, because pain was one of the worries that she had.
Yeah, I was really worried about pain, but I was given the right type of medication and enough of it, so even at home I wasn't in a lot of pain. And even when I was in pain, it wasn't severe pain all the time.
Yeah. So it was a true experience for us, and really, honestly, we're so grateful that we went through the surgery. And just to tell you that Djanessa is the one who found the doctor and we ended up being here at the hospital. It was an amazing experience. And it's not just the issue of coming to do the surgery. There is the days leading up to the surgery. She needed to do the nerve test, the muscle test, the MRI scans. It was really just an experience that we are so grateful for and so honored to really have done it at this hospital. It's amazing.